My name is Kellen Edwards, and this is my health history assignment. I'm going to do an urgent care setting with a pregnant lady, and I'm going to go ahead and start my interview now. So this is just me coming into the room and introducing myself just like I would on a normal basis. Good morning. How are you this morning?
I'm doing okay.
Are you Miss Martha Stocks?
I am.
Perfect. What is your birthday?
3/20/90.
Perfect. All right. So how you feeling today?
I've been feeling pretty nauseous. I've been vomiting about every 2 to 3 hours for the last 2 days. Yeah.
Okay. So you've been pretty nauseous and vomiting for past hours and 2 days. Do you have any other issues going on? I mean, any headaches, or do you feel really tired or anything?
I've not been able to keep anything down on my stomach. I've had a headache, yes. So mainly just nauseous, throwing up, and headaches, yeah.
Okay, and you are pregnant, correct?
Yes, 9 weeks.
9 weeks pregnant, okay. Great. So I'm just going to ask you some questions, and then we're going to get started with your stuff, okay?
Okay.
Are you married?
Yes.
How long have you been married?
3 years.
Congratulations.
Thank you.
Where were you born at?
Wisconsin.
Wisconsin, perfect. What brings you down here?
His job.
Just a job. Okay, cool. Awesome. Alrighty. So today you're 9 weeks pregnant. You're having some nausea and vomiting. How long has this nausea and vomiting been going on?
2 days.
2 days now. And you said you've been vomiting every 2 or 3 hours. You're not keeping anything on your stomach, no fluids or anything?
Not really.
Okay. Well, that's not very good. Then we got to get you some help. I'm going to go over a list. I just want you to tell me if you've ever had any issues like this or what's been going on, okay? Do you have a history of any skin disorders?
No.
Okay. Any recent weight loss or weight gain? No? Okay. Not far enough along yet to start dealing with your weight, huh? Any dizziness or frequent headaches?
Just associated with how I feel right now, headaches, yeah,
Headache,
but
okay.
not normally.
But no dizziness or passing out,
Mm-mm.
fainting, nothing
No.
like that, okay. Any recent changes in your vision?
Mm-mm.
Any hearing loss, hearing changes?
Mm-mm. No.
Okay, great. Any toothaches or sores in your mouth? Any swelling or lumps, tenderness in your neck, breasts, or underarms? No lymph nodes. Never had any. Feel like you have any?
Never had any problems with that.
Okay. Any history of lung diseases such as asthma, COPD, anything like that?
Mm-mm.
Okay. Cardiovascular issues such as, have you ever had a heart attack? Any congestive heart failure, coronary artery disease?
No.
Any cholesterol issues?
No.
No.
In the family, but
In
no.
the family, but not with you. Okay. I'll make a note of that. All right. Any tingling or numbness in your extremities, discolorations of your skin? Do you feel like your hands and your legs have ever been blue or anything like that?
No.
Okay. No pain in your calves or anything like that? Okay, great. Any GI issues, heartburn or reflux?
No. I do have acid reflux. Yes.
You have acid reflux, okay. Any abdominal pain? Ever had a colonoscopy or anything like that? Never had a colonoscopy, okay. Do you have any urination changes recently with your pregnancy, or just
More often, but
okay?
That's,
That's normal for pregnancy, huh?
Mm-hmm.
All right. Any arthritis or gout issues?
Mm-mm.
Okay. Have you ever had seizures, fainting spells, or anything like that? Okay. Are you depressed or have any recent changes in your hormones or anything like that?
No.
Okay. Not been crying more or anything like that?
No, not that no.
All right, great. And you ever had blood transfusion?
No.
Okay. Do you have a history of diabetes or any thyroid issues or anything like that?
No.
Okay. All right, I'm going to ask you some other questions now, okay?
Okay.
Do you have any childhood illnesses such as measles, mumps, rubella, chickenpox, rheumatic fever, polio? Ever had any of those?
No, nothing like that.
Okay. Do you remember the last time you had your tetanus shot?
3 years ago.
3 years ago. Okay. What about hepatitis?
2 years ago.
Okay. Have you ever had a flu shot?
December of 2013.
Okay, so last year. All right. Have you ever been vaccinated for pneumonia?
No.
Okay. What about chickenpox?
As a child, yes.
Okay. What about MMR, measles, mumps,
As
and
a
rubella?
child.
Okay, so both of chickenpox and MMR as a child. When is the last time you saw your primary care physician, or who do you
3 weeks
see?
ago. I seen Melissa O'Neill.
Okay.
That was 3 weeks ago.
And she's going to be seeing you while you're pregnant?
Mm-hmm.
Okay, great. Have you ever, is this your first pregnancy, first time trying and everything? Wow, you're lucky then. Great job.
First time.
All right, medical issues. You said you have reflux. Is that the only thing that's medically wrong? Have you ever had, anything such as cholesterol issues, cardiovascular, anything like that?
Mm-mm.
Great, you're very healthy then. I'm gonna jot down too, just for the doctor's help. There we go. Surgeries. Have you ever had past surgeries? Your tonsils or adenoids removed? A DNC, a dilation and curettage, anything like that?
No, the only surgery I've ever had was an arm. I broke my right arm.
Okay.
When I was 11.
When you were 11 years old.
And they had to put a pin in it, but
Oh.
that's it.
Okay, so they pinned it from the inside then.
Mhm.
Where'd you have that done at?
Um,
Which hospital?
I don't know. It was. I don't know.
You're not sure? Okay,
Mm-mm.
that's no big deal. Alrighty, have you ever been hospitalized for any other reasons, any sicknesses or anything like that?
Mm-mm. That's
Never?
it.
Okay, perfect. Moving on. You said you have never had a blood transfusion, correct?
No.
All right. We have the state mandates that we have a list of the drugs that you take, the strength, and the frequency taken. Do you mind going through? Do you have your medications with you today, or do you know what you take?
I know what I take.
Okay.
Prilosec, it's 40 milligrams,
Okay.
and that's 3 times a day.
Perfect.
And then a prenatal vitamin 1 time a day.
Take that once daily.
Mm-hmm.
Okay, great.
That's it. That's the only things I'm on.
Oh, that's awesome. Are you allergic to any medications?
Not that I'm aware of.
All right, great. So I'm going to go through some questions about your diet, exercise, caffeine, and alcohol intake, okay? Would you say that you exercise more than 4 times a week, less than 4 times a week, just climbing stairs and walking, or what would you say? How would you say your exercise is?
Probably regular, no more than 4 times a week.
No more than 4 times a week. Alrighty. Are you dieting at the moment?
No, trying to eat better as far as pregnancy goes, but not a strict diet of any sort, no.
Okay, no strict diet though.
Mm-mm.
Alrighty. How many meals do you eat an average day?
4.
4 meals a day. And are you prescribed anything from your physician as far as a medical diet or anything like that?
Mm-mm.
Okay, great. Your salt intake. Would you say that you take in a lot of salt, or you don't take in very much salt at all?
I'd say low.
Low. Okay. What about your fat intake?
Probably about medium.
Medium.
A lot of nuts. Yeah.
Okay, great. That's good for you then. Nuts, healthy
Mhm.
fats. Your caffeine intake. Would you say you drink coffee, tea, cola, or mostly water? How would you rate that?
Mostly water.
Mostly water.
Maybe 1 tea, like a sweet tea.
Okay. How much tea? You would do one day or
Maybe
something
like
like that?
1 meal.
One meal.
Maybe,
Okay.
yeah.
Perfect. Do you drink any alcohol?
No, not currently while I'm pregnant.
Okay. Did you previously?
Mm-hmm.
Okay. What kind of alcohol did you drink?
Just like an occasional wine or something.
Okay. About how many per week?
Maybe like 2.
Okay. Are you concerned about the amount you drink?
No.
No drinking problems or anything like that?
No.
Okay, good. Have you ever experienced blackouts from drinking or anything like that?
No.
Okay. Are you prone? Does anybody in your family have drinking problems, binge drinking, anything
No.
like that? No. Okay. Good. You never drive after drinking, correct?
Correct.
All right. Good. Do you use tobacco?
No, never.
Great. So never ever. What about any recreational or street drugs such as cocaine, marijuana, anything like that?
No.
No. Okay. Have you ever given yourself street drugs with a needle?
No.
No. Okay. Great. Are you sexually active?
Yes.
You are. Okay. You're already pregnant, so I'm not going to ask you if you're trying for a pregnancy there. Were you on birth control before you got pregnant?
Yes.
You were. Okay. You just stopped so you could.
Right.
Okay.
Yeah.
Great.
Trying.
Do you have any discomfort with intercourse?
No.
No. Okay. Good. So illness related to the HIV virus, such as AIDS, has become a major public health problem. Risk factors related to this illness include intravenous drug use and unprotected sexual intercourse. Would you like to speak with your provider about your risk for this illness? No. Okay. Do you live alone?
No, with my husband.
Okay, you live with your husband. Great. Do you have frequent falls or anything like that?
No.
Any vision issues or hearing loss?
No.
Okay. Do you have an advanced directive or living will?
No.
No. Okay. Would you like information on the preparation of these?
Sure. Yeah.
Okay, we can have somebody talk to you about that, and that will be something good for you.
Okay.
Physical and or mental abuse have become a major public health issue in this country. This often takes form of verbally threatening behavior or actual physical or sexual abuse. Would you like to discuss this issue with your provider? You think that's an issue for you?
No.
Okay.
That's-
So, your family health history. Your father, how old is he?
56.
56 years old, okay? Does he have any significant health problems or anything like that?
Acid reflux,
Okay.
like me.
That's where you got it from, huh?
Yes, and
Alright.
cholesterol.
Cholesterol issues. Alrighty. What about your mother? How old is she?
52.
Does she have any health issues?
None.
Oh, okay, awesome. Do you have a sibling?
I do. A brother.
How old is he?
He's 27.
27. All right, so you're the baby, sis. Does he have any significant health problems or anything like
No,
that?
he's healthy.
Very
Athletic.
Great. You don't have any children, but you hopefully will have one in a
Yes.
couple more weeks,
soon.
huh? I guess like 30, 32 more weeks, something like that. Yeah. Your maternal grandmother, so your mom's mom, does she have any significant health issues or anything?
She had skin cancer. But,
Okay.
I mean, it's removed. She's cancer free.
She never had to take chemo or anything like that. Okay. How old is she?
78.
Okay.
Both
And
of her parents are 78.
okay, so your grandfather, he's 78 as well. Does he have any significant health issues?
High blood pressure,
Okay.
cholesterol, I think.
Okay. So maybe some cholesterol and blood pressure issues. What about your dad's mother? How old is she?
80.
80 or so? Okay. Does she have any health issues, significant health problems?
I know she has some arthritis.
Okay.
She takes the blood pressure thing, I believe.
Blood pressure medication. Okay.
Yeah,
But
that's
nothing
about it.
nothing that she's ever
Nothing.
had to have like surgery on or anything like that. Okay. What about your paternal grandfather, so your dad's dad? How about him? How old is
He's
he?
deceased.
He's deceased. Okay, I'm sorry to hear that. Did he have any significant health problems that caused him?
Congestive heart failure, diabetes,
Okay.
blood pressure.
Okay, so he had congestive heart failure. Is that what happened to him?
Mhm.
I'm sorry to hear that. All right, so now I'm going to go through some more yes or no questions with you, okay? You just tell me yes or no if it's a problem.
Okay.
Is stress a major problem for you?
No.
Okay, do you feel depressed?
No.
Or do you panic when you get stressed?
I guess, yeah.
Okay, you just get worried, huh?
Yeah.
Do you have problems with eating or your appetite?
I've been a little, I've not been hungry the past 2 days, no.
Okay, but normally, do you have problems with that? Okay, good. Do you cry frequently?
No.
Have you ever attempted suicide?
No.
No. Have you thought seriously about hurting yourself?
No.
No. Do you have any trouble sleeping?
I mean, just with, like the past, like I was saying, with the nausea, the vomiting,
Getting up every
yes,
couple
but
hours.
no, usually no.
Okay, great. Have you ever been to see a counselor or anything like that?
No.
Okay. When did you start your period?
Like,
As far as like when you were younger, when did you start? When was your first
I was
menstruation
16.
cycle? 16. Okay, 16 years old. When's the last time you had a period?
About 3 months ago.
Okay.
I'd say.
And you have a period. How often did you have your period? Was it fairly normal?
It was normal, yeah. I was on birth control, so it was regulated.
Okay. Every 4 weeks then?
Yeah,
Okay.
once a month.
Would you say they were heavy, irregular spotting, or do you have a lot of
Pretty
pain?
light, no pain. It was just.
Okay. So you're pregnant right now. Have you said you've never had any previous pregnancies or any births or anything? Okay, great. So you are pregnant, yes. Have you ever had you never had a C-section, you never had a baby before, but a D&C surgery or anything? Is when they go in and scrape out the cervix to check for
No.
abnormal cells. Okay, great. Do you have any vaginal itching or discharge? Nope. Any urinary tract, bladder, or kidney infections within the last year?
No.
Okay. Any problems with the control of urination? Do you spot ever? I mean, just have a
No.
little leakage or anything like that? What about hot flashes or sweating at night? Okay. Do you have menstruation tension, pain, bloating, or irritability around the time of that period?
No,
No.
not really.
Okay. Have you experienced any recent breast tenderness, lumps, or nipple discharge?
No.
Okay. And the last time you had a pap smear and rectal exam, last time you went for your yearly physical, when was that?
February.
Okay.
2013.
Okay, perfect. Alrighty, so I think we're good. What I'm going to do is I'm going to step out and give the doctor my information, kind of give him my information on you, and hopefully we can get you something for some medication or something for that dehydration. Okay? Alrighty. That was it.